ಕೆಎಲ್ಇ ಹಾಸ್ಪಿಟಲ್ಸ್ ಹುಬ್ಬಳ್ಳಿ ಹಾಗೂ ಕಸಗೋದ ಮಹಾಪೋಷಕರು ಇವರನ್ನು ವೈಯಕ್ತಿಕವಾಗಿ ಮತ್ತು ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಶಾಖೆ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಶಾಖೆಯ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕವಾಗಿ ಸ್ವಾಗತಿಸುತ್ತೇನೆ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಶಾಖೆಯ ರಾಜ್ಯಾಧ್ಯಕ್ಷರು ಆತ್ಮೀಯರೂ ಆದ ಡಾಕ್ಟರ್ ವೀರಭದ್ರಯ್ಯನವರಿಗೂ, ಗೌರವ ಕಾರ್ಯದರ್ಶಿಗಳಾದ ಡಾಕ್ಟರ್ ಸೂರಿರಾಜು ಅವರಿಗೂ, IMA KSB CGPಯ ಕಾರ್ಯದರ್ಶಿಗಳಾದ ಡಾಕ್ಟರ್ ಮಹೇಶ್ ಜಿ ಅವರಿಗೂ ಆದರದ ಸ್ವಾಗತ. ನಿಯೋಜಿತ ರಾಜ್ಯಾಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ ಹರೀಶ್ ದಲಂಬೆಟ್ಟು ಅವರಿಗೂ, ನಿಕಟಪೂರ್ವ ಅಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ VV ಚಿನ್ನಿವಾಲ್ರವರಿಗೂ, ವೆಬಿನಾರ್ದಲ್ಲಿ ಭಾಗವಹಿಸಿದ ಎಲ್ಲ ಮಾಜಿ ಅಧ್ಯಕ್ಷರುಗಳಿಗೆ ಮತ್ತು ಭಾಗವಹಿಸಿದ ಎಲ್ಲ ವೈದ್ಯ ಮಿತ್ರರಿಗೆ ಹೃತ್ಪೂರ್ವಕವಾಗಿ ಸ್ವಾಗತಿಸುತ್ತೇನೆ. ಈಗ ಡಾಕ್ಟರ್ ಮಹೇಶ್ ಅವರಿಗೆ IMA ಪ್ರಾರ್ಥನೆ ಮತ್ತು ಧ್ವಜವಂದನೆ ನಡೆಸಿಕೊಡಲು ಕೇಳಿಕೊಳ್ಳುತ್ತೇನೆ.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪ್ರಾರ್ಥನೆ. ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲಾ ಆಸೆ ಆಮಿಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವವರು ನಾವಾಗಿರಲಿ. ಫ್ಲಾಗ್ ಸ್ಯಾಲ್ಯುಟೇಷನ್. We, the members of Indian Medical Association, stand here to salute our national flag. Its honor and glory is the light and strength, and its course shall be our course. We pledge our allegiance to it and realizing our responsibilities as the accredited members of this national organization. We swear we will dedicate everything in our power to see it fly high in the Committee of Nations. Jai Hind, long live IMA.
ಡಾಕ್ಟರ್ ಮಹೇಶ್ ಅವರು ಇಂದಿನ ಉಪನ್ಯಾಸಕರಾದ ಪ್ರೊಫೆಸರ್ ಡಾಕ್ಟರ್ MG ಹಿರೇಮಠ್ ಇವರ ಪರಿಚಯ ಮಾಡಿಕೊಡಲು ಕೇಳಿಕೊಳ್ಳುತ್ತೇನೆ.
Dr. MG Hirameth is one of the renowned gynecologists to say, and he is the director and of General Administration and Hospital Clinical Services, Director KLE, JGMMC and KLE Hospitals Hubli, ex-principal KLE, Kahers JGMM Medical College Hubballi, Academic Council Member, Kahers Deemed University Belagavi, Chief Patron and Founder Secretary of Kasoga, and is also President Rangavaidyaru Cultural Association Hubballi, and is also former Director of Karnataka Institute of Medical Sciences Hubballi, and he was also Director Hatch IVF Center, Matoshri Women's Hospital Hubballi, and he was also ex-chairman of the Breast Committee of Foxy, and also past president of Foxy, CEO Arya Vedanta Scan Center Hubballi, and past president of HD OGS and Kasoga, past Senate member of Karnataka University Dharwad, past president of Rotary Club Vidyanagara Hubballi, and he was also Secretary General Karnataka Medical College Alumni Association Hubballi, and he was also President Shri Shanteshwar Educational, Religious and Philanthropic Social Sciences at Varanasi, UP, and is a recipient of Millennium Fellow Award of our Excellence in Academics by Foxy in 2000. So we warm welcome you, sir, for this webinar on common gynecological problems for general practitioners. Welcome, sir. And I request Dr. Veerbhadraya sir to speak.
ಈಗ ರಾಜ್ಯಾಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ ವೀರಭದ್ರಯ್ಯನವರು ಅಧ್ಯಕ್ಷೀಯ ನುಡಿಗಳನ್ನು ಹೇಳಲು ಕೇಳಿಕೊಳ್ಳುತ್ತೇನೆ.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಈ ದಿನ ಸಂಜೆ CGP ವತಿಯಿಂದ ಈ ಒಂದು ವೆಬಿನಾರ್ ಗೈನಕಾಲಜಿಕಲ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇನ್ ಜನರಲ್ ಪ್ರಾಕ್ಟೀಸ್ ಅನ್ನೋದು ಒಳ್ಳೆ ಸಬ್ಜೆಕ್ಟ್ನ ಆರಿಸ್ಕೊಂಡಿದ್ದಾರೆ, ಮತ್ತೆ ಒಳ್ಳೆ ಸ್ಪೀಕರ್ನು ಸಹ ಆರಿಸ್ಕೊಂಡಿದ್ದಾರೆ. ಹಿರೇಮಠ್ ಸರ್ ಕರ್ನಾಟಕ ಸೊಸೈಟಿ ಆಫ್ ಆಬ್ಸ್ಟೆಟಿಕ್ಸ್ ಅಂಡ್ ಗೈನಕಾಲಜಿ ಅಧ್ಯಕ್ಷರಾಗಿದ್ದರು, ಉತ್ತಮವಾಗಿ ಸೇವೆ ಸಲ್ಲಿಸಿದ್ದಾರೆ. ಸೊ ಅವರು ಒಳ್ಳೆ ಪ್ರೊಫೆಸರ್ ಸಹ ಆಗಿ ಒಳ್ಳೆ ಹೆಸರು ಮಾಡಿದ್ದಾರೆ. ಅವರು ನಮಗೆಲ್ಲ ಒಳ್ಳೆಯ ರೀತಿಯ ಏನು ಟಿಪ್ಸನ್ನು ಕೊಡ್ತಾರೆ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಭಾವಿಸಿ ಅವ್ರಿಗೆ ಈ ಒಂದು ವೆಬಿನಾರ್ಗೆ ಸ್ವಾಗತ ಕೋರ್ತಾ ಈ ಒಂದು ವೆಬಿನಾರ್ ಯಶಸ್ವಿ ಆಗಲಿ ಅಂತ ಹಾರೈಸ್ತೇನೆ. ಧನ್ಯವಾದಗಳು.
ಧನ್ಯವಾದಗಳು ವೀರಭದ್ರಯ್ಯನವರಿಗೆ.
ಧನ್ಯವಾದಗಳು.
ಈಗ ಪ್ರೊಫೆಸರ್ ಡಾಕ್ಟರ್ MG ಹಿರೇಮಠ್ ಸರ್ ಉಪನ್ಯಾಸ ನೀಡಲು ವಿನಂತಿ.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Respected President of Karnataka IMA, Dr. Veerbhadraya sir, Honorary Secretary Dr. Surya sir, my very good friend Dr. Karveer Prabhu Kalkon, Dr. Mahesh G sir, all the senior members of IMA. At the outset, I would like to thank the IMA, KSB, GCP for giving me this opportunity to meet all the old friends of IMA, younger generation of IMA members on this day. Respected President sir, I have been asked to talk on common gynecological problems in general practice. I am into this obstetrics and gynecology for last 45 years. Today's my talk I would like to dedicate to my teachers, Dr. S.N. Kaulgud, Dr. Indumati Vimalakshi, Dr. A.P. Chandrasekhar, who have molded me as an obstetrician and gynecologist. In my last 45 years, I have come across many practitioners who have got hesitation to practice OBGYN. I don't know the reason. Even today also, most of the general practitioners do not practice OBG. They will practice all other specialty. First of all, I would like to raise 3 questions. Whether a general practitioner can practice OBGYN or not? My answer is yes. Whether their clinic is well equipped to practice OBGYN? The answer is no. Can it be done? The answer is yes. To elaborate this, most of our general practitioners have got a very small clinic, hardly one room, where the consultant, patients, patient attenders, everybody sits in single room. To practice OBGYN, you need some privacy. My suggestion to general practitioner is, you please have at least 3 rooms, one for you to consult, another for patient to be examined along with the minor investigation, and another for the counseling. And very minimum instruments. OBG doesn't need too many instruments for a general practitioner. As the instruments have changed, the investigations have also multiplied. The surgeries have become minimally invasive, but the complaints of the woman have remained the same. Irregular bleeding, excessive bleeding, vaginal discharge, pelvic pain, infertility, menopausal discomfort, and fear of cancer. The general practitioner continues to be the first and the most important point of contact for every woman. Today, I will share not merely textbook knowledge, my clinical experience for the last 45 years by doing mistakes, learning, and relearning. The role of the general practitioner in OBGYN practice is, the gynecology in general practice demands very good clinical judgment, sensitivity to the client, ethical clarity, timely referral, and patient education. Many women hesitate, go to a gynecologist. Their first approach will be the family physician. That's why my appeal to family physician is start practicing OBGYN. I will assure you that it is not a very difficult subject like cardiology. It is not a very difficult subject like nephrology and neurology. It is the easiest subject. Many of the patients will tell you the diagnosis. Only thing is you have to prescribe the medicine and see their problems. And the common gynecological problems in general practice, I will be completing another 35-40 minutes. If time permits, we will have some discussion and questions. I will be very happy. Life expectancy of the Indian woman has gone very high. On an average, it is 71 years. The men are living only up to 68.5. Woman does not just age biologically, she evolves physically, hormonally, emotionally, and socially. Every stage has unique gynecological challenges. I broadly divide the woman's perspective into 5 stages. My general practitioner friends first look at the age of the patient. Which age group patient has come to your clinic? Is it a child between age of 1 to 15? Is she an adolescent girl between the age of 15 and 25? Is she a woman of the reproductive age between 25 to 45? Is she a woman of the perimenopause 45 to 55? Is she a woman of menopause and elderly woman? This will give a broad idea that how to understand the health issues of the client. Childhood is a very sensitive phase. It involves a physical growth phase, hormonal awakening, and it is emotionally vulnerable and social challenges. And most common problems in these age group are poor hygiene. Educate them how to look after their child's health. Worm infestation and tight synthetic clothing to be avoided because those will give a lot of problems. The reason is low estrogen state, usually asymptomatic, and there are many cause urinary symptom. Another very common problem, the parents will come to you saying that my daughter has attained menarche very early. That is before the age of 10. Either by looking at her breast development or starting of the menstruation, and what we call it as a precocious puberty. And whenever the precocious puberty is there, you need to further investigate what is the cause for the precocious puberty. Then you can refer the patient to the gynecologist. Another very common problem, what you find is a delayed puberty. That means no development of secondary sexual characters by the age of 13, no menarche by 15th year. And some of the girls are brought to you saying that she had primary amenorrhea, not noticed the periods at all. These are very common what you find. And the increasing report of abuse has been very problematic, often by known person. Physical injuries, presence of sexually transmitted diseases, psychological trauma. What is your role as a general practitioner? Your role is gently talk to them, examine the child, document the findings, and mandatorily you report to the POSCO Act, and psychological support should be given. So in young girls' childhood, your role is that early diagnosis and parental counseling is very, very important, and nutritional guidance. Today, all of you have come to know that HPV vaccine will prevent almost 100% cancer of the cervix, one of the common cause of death of the woman. So HPV vaccination education should be given, that all the girls in the age group of 19 to 14 should receive an HPV vaccine Gardnerella 2 doses. And education about menstrual hygiene is also very important. Today we are going to the primary schools, the higher secondary schools, and we are giving them an education how to use the menstrual pad. And awareness is also very, very important. So the other hygienes, other things, take home message is most problems are preventable. Hygiene education is very powerful. Early intervention avoids lifelong issues and protect the girl child both physically and emotionally. The next group of patients which you are going to get is the adolescent girl. Today, large number of adolescents or girls are visiting the gynecologist. I am staying in Vidyanagar of Hubli, where there are so many educational centers. And all these girls who are studying in PUC, they are coming with so many gynecological problems like irregularity in the menstruation, loss of favor, not able to concentrate in education, depression. I think this is one which a general practitioner can practice without doing any gynecological examination. Especially irregular periods, they are all due to the immature HPO axis development. Heavy menstrual bleedings, again, need to be investigated. And one common complaint most of the girls they give is severe dysmenorrhea. Now, dysmenorrhea is almost to 20% of the young girls. And cause of the dysmenorrhea should be identified. And you can request for a ultrasound examination, which may give you some tips what is the problem. So that can be treated with common analgesics, which will reduce the pain. Another very common we find in adolescent is anemia. Large number of these young girls are anemic. If you do a hemoglobin estimation of them, you will find more than 30% of the college going girls, their hemoglobin is less than 10. Our aim is that every woman should have a hemoglobin more than 10, that is in double digit. And anemia is another very common problem which will affect the adolescents. So the clinical tip is most irregular cycles in the first 2 years are common, which doesn't need any treatment. Second most common problem in PCOS, that is adolescent, is polycystic ovarian disease. This is increasing a lot. 20 to 25% of the young girls are coming and they are only telling that I have got PCOS. And that will give rise to obesity, irregular cycles, acne. Girls are more worried when they develop too much of the acne. They feel ugly. They are not able to join in the social group. Hirsutism, development of excessive hairs, and early diagnosis will prevent three more common problems in future, that is infertility, metabolic syndrome, and diabetes. Now, and another problem is the violence. Again, violence is very common in young girls and that can give rise to chronic pelvic pain, future sexual dysfunction. They go into depression and anxiety, and few of the girls may go for a school dropout and early marriage may take place. A girl child needs protection, not just remaining silent. And what happens in this age? Puberty completion, establishment of the ovulatory cycle, physical maturity, emotional development, identity formation, and exposure to social and digital world. So these can be treated very easily. Another common problem which we are finding in young girls is thyroid disorders, particularly hypothyroidism. That if you suspect that there is a thyroid dysfunction, you go for a simple investigation, ask for a thyroid stimulating hormone status, what is called as TSH. If the TSH is between 3 to 5, it is normal, and any TSH more than 5 should be considered as abnormal and an indication of hypothyroidism. Heavy menstrual bleeding, again due to anovulatory cycles, because in early part of their life the HPO axis is not well developed. Bleeding disorders may be there, anemia, and severe dysmenorrhea is another one which should be investigated and sent. Now, of course, the acne can be treated by general practitioners. Hirsutism needs investigation. Please refer to the gynecologist as early as possible. Irregular periods can be treated by giving them OC pills. Infertility is a concern because today large number of patients are becoming infertile. The reasons I will discuss you when I take up the infertility problem. Now, long-term risks are there like diabetes, metabolic syndrome, endometrial hyperplasia, which will lead on to the carcinoma, endometrium. So what is your role as a general practitioner? Early screening, lifestyle counseling, and prevent the long-term complications. Now let us come to the common problem of white discharge. White discharge is a very common problem. 1/3 of the patients are having this white discharge. And white discharge is not a very serious gynecological problem. Only thing is, You need a speculum and retractor to be used and look at vulva, vagina, cervix. If there is an infection, it is a vaginitis or a cervicitis, the cause of which may be either a bacterial vaginosis or candidiasis, and both can be treated 100% by using simple drugs like antibiotic or antimycotic drugs. And sexually transmitted diseases must be looked for. And unsafe sexual practices are there now. You should have a vigilance and you should identify. So what is the red flag in these young girls? Foul smell, fever, pelvic pain. Immediately you refer to the gynecologist. And the teenage pregnancy has become another problem. Large number of women are becoming pregnant before the age of 20. And you know, teenage pregnancy has got a risk. Incidence of anemia is very high. Preterm labor is very high. Emotional trauma. They have to drop out from the school. So what is your responsibility as a general practitioner? Be non-judgmental counseling. Don't give any judgment. And safe abortion services are available. They can go to the abortion center, get it aborted, because they have to build up their career, and contraceptive advice must be given. Now, contraceptive awareness in young girl is very, very important. They have got the wrong conception, myths are there, so they have got fear. So all those should be removed, and you must advise them. Now, as a general practitioner, also you can give OC pills because you don't need any investigation to give OC pill. If somebody has come for a contraception, today in the market OC pills are available, which you can prescribe. Even IUCD insertion can be learned by the general practitioner. And injectable contraceptives have come, which can be given once in a month. Of course, the barrier method like condom education can be given to the couple. Now again, the sexual violence in this age group is very high. The age group is highly vulnerable. Harassment, assault, rape, online exploitation, intimate partner violence, physical injuries, unwanted pregnancy, depression, STDs. What is your role as a general practitioner? Mandatorily reporting to the concerned authorities, giving a knowledge of emergency contraception, STI prophylaxis, and psychological treatment. So psychological impact can happen to the body image issues. Social media comparison themselves, they start comparing with all film land people. Eating disorders will develop. Self-harm and gynecological complaints are also seen. What is most important, I feel, is a good nutritional and lifestyle issues to be discussed. Large number of young girls, they go for junk food culture, and give them a warning that if you eat junk food, you are going to lose your health in future. And large number of young students are becoming sedentary in life. They are not doing any exercise. They are not walking. And this burden of PUC 1 and 2 has given so much pressure on them. They say that they have no time to do the exercise at all. They become obese. Anemia is a common problem. Vitamin D deficiency is a very common problem. If you give vitamin D, they will improve a lot. What are the red flags for the general practitioner to notice? Severe pelvic pain in a young girl, please refer immediately to the gynecologist. Amenorrhea more than 3 months, please refer to the gynecologist. Any girl has told you that she has a postcoital bleeding, take it very serious. It is an indication of carcinoma cervix. Excessive hair growth, rapid weight gain, and breast lump are very, very important. Sir, what is your role as a general practitioner? You are the first contact doctor. Early diagnosis, confidential counseling, vaccination. Today, I would like to stress you more and more on vaccination because HPV vaccine is available at a very reasonable rate, not very costly. Give vaccination to all the girls from the age of 9 to 14. And if you give 2 doses of vaccination, 100% carcinoma cervix can be prevented because HPV virus is identified as the causative agent of carcinoma cervix. Menstrual hygiene education is very, very important. Lifestyle correction, sex education also is very important, which can be given by the general practitioner because you are so close to the family. They treat you as a family member and they can tell you many things which are not told to others. Social reality also should be identified. Academic pressures are so high for the young girl today and social gender discrimination is happening. So that's why they should be educated. Now, what is my take-home message for you as a general practitioner for this category of the young girls? This is the foundation decade of woman life. Most chronic gynecological problems start from here. Early counseling, healthy future mother. Protect, educate, empower the girl child. Today, girl child empowerment is very, very important. Let me discuss about the problems in this age group, which is very, very important, 25 to 45 years. This is the reproductive and responsibility phase. This is the decade, marriage. Marriage counseling must be done to the young people who come to you, that who are the category of people whom they should marry, what are the pre-marriage counseling you should discuss, and marriage is the beginning of their reproductive life. And pregnancy, whether a general practitioner can practice the examination of antenatal case, my answer is yes, because antenatal examination is not a very complicated. What you need is a proper history and examine the weight, blood pressure, and do minimum investigation like hemoglobin, blood group, HIV, HbA1c, urine examination. I think most of the problems of antenatal case you will identify. Childbirth, refer to the center where the good facilities are available. And career stress, emotional burden can be removed. Now again, menstrual disorders are very, very common in this, like heavy menstrual bleeding, irregular intermenstrual bleeding. The causes are known causes of gynecological like fibroid, adenomyosis, endometriosis, and thyroid disorders, polycystic ovarian disease. This needs to be referred to the gynecologist as early as possible. The next biggest problem today we are facing is infertility. 20 to 22% of the individuals are today infertile. The reason is they are getting married at a late age. They are getting married because they want to have a career. That is putting a lot of pressure. They are getting married after the age of 30. And by the age of 35, their ovarian, the reserve is going to be reduced. So that is the main problem. Lifestyle changes, polycystic ovarian disease can be treated, tubal factors can be treated. Male factor has become a biggest problem. Earlier we used to say that 80% of the problem is female, 20% of the problem is male. But today, male and female problems are equal. 50% male, 50% female. But the biggest problem what we are facing is that if we find a male factor, it is very, very difficult to treat. And majority of the cases are azoospermia or oligoasthenospermia, where till today we do not have any treatment for that. But the problems of the woman, lot of investigations have come in a big way that we can solve the tubal block problem. Ultrasonography has helped a lot. Laparoscopy and hysteroscopy can help a lot. That's why results are more, and we can give definitely a good result in them. There are a lot of treatment options for both female and male factor evaluation. Extensive investigations we are going to do. Correct the hormonal imbalance by using hormones. Ovulation induction can be done. IUI and IVF, they give results almost to more than 50 to 60% the pregnancy rate. Then the most common problem is pregnancy related. So as a general practitioner, can you do routine antenatal checkup or not? My answer is yes. You can look for anemia clinically. Keep on simple hemoglobinometer examination. Do the hemoglobin. If their hemoglobin is less than 10, give them oral iron. If the hemoglobin is less than 7, ask for a parenteral iron. If the hemoglobin is less than 4, blood transfusion is a must. Gestational diabetes is also increasing. The incidence of gestational diabetes in pregnancy has gone to 12 to 18%, and more so in South Karnataka compared to the North Karnataka. Hypertension is the biggest problem in pregnancy. And if you do just an examination of the blood pressure, and you should keep that their blood pressure must be less than 140 by 90. Anytime their blood pressure is seen to be more than 140 by 90, immediate the treatment should be started. Of course, recurrent pregnancy loss, preterm labor has to be examined by the gynecologist. As a general practitioner, what is your role is you can do an early antenatal booking and you can do the screening and counseling. And postpartum issues are all very common. Postpartum depression, lactation problem, pelvic floor weakness, urinary incontinence. often they are very much ignored. She must be strong. She's a mother now. And common pelvic pathologies like fibroid, ovarian cyst, endometriosis, PID, cervical infection, all these must be sent to the gynecologist as early as possible. A word about cervical cancer, one of the leading cause of death in the mother. The cervical cancer, the incidence is increasing day by day. Simple pap smear, which general practitioner can also do. Just put the patient in the lithotomy position, collect the sample from the surface of the cervix, send it to a pathologist. He will give an opinion whether there is any evidence of malignancy, and then you refer to the gynecologist. HPV testings have come now, that you can do a blood test and know whether there is a HPV infection, which is a precursor of the carcinoma of the cervix. Early detection saves life. Unfortunately, what is happening is that the patients are coming to the gynecologist when the cancer cervix is in stage 3, stage 4. When the cancer cervix is in stage 3, stage 4, you can't do a surgery. Only thing left is a radiotherapy and a chemotherapy. 5-year survival rate has been fixed, and that will come down to less than 25%. So general practitioners can help a lot to reduce the cervical cancer burden in our country. And domestic violence in the elderly women are also becoming more and more. Physical abuse, sexual abuse, emotional abuse, financial problems. So you should, and forced intercourse, lack of consent, and consequence to that is unwanted pregnancy. And psychological impact, again, lot of psychological problems are seen in this age group. So that's why the general practitioner must discuss with them. Anxiety disorders can be treated. Suicidal thoughts are there, which can be prevented. Loss of self-esteem and chronic pelvic pain, headache, fatigue, they need to be evaluated. Work-life stress has become the biggest problem. Career pressure has become very high. Child care, elderly care, financial burden, hormonal imbalance, they all have put them into a big problem. Hormonal fluctuations can occur in a woman, mood, elevators, libido, and anxiety disorders, which can be identified. So social realities like early marriage pressure, pressure for male child, this is another problem. I have seen lot of families where the woman is put into lot of pressure, asking her to deliver a male child. And the science says that it is not the woman who is responsible for the male child. It is the man who is responsible for the male child. Y chromosome is the responsibility for male child. But unfortunately, the women are treated in such a bad manner that it is a very pathetic. And repeated pregnancy loss also puts the woman into a loss of confidence, and limited healthcare access are there. So that's why good healthcare should be there. So what are the red flag symptoms for a general practitioner? The most important is postcoital bleeding. Any woman who tells you that she has got a postcoital bleeding, immediately send it to a gynecologist. We look at the cervix. Earliest lesion can be detected on the cervix. And if you do a surgery at that stage, it is almost sees a cancer free. And local, the treatments have come. Sudden severe pain, again, immediate treatment. Heavy bleeding causing severe anemia and rapid abdominal enlargement, persistent vaginal discharge, and breast lump. My general practitioners, they should make habit of discussing them with the breast problems. The second most common problem today women are dying is because of the breast cancer. And breast cancer can be detected at a very early stage by simply making them to learn how to examine the breast by themselves. That is self-breast examination. We must ask them to stand before a mirror, keep their hands on the trunk, and examine one breast at a time by palpating the breast in the 4 quadrants, starting from upper lateral, upper medial, lower lateral, lower medial. If they find any lump in their breast, they should report immediately. Or ask them to squeeze the breast. If they find any secretion abnormal, either a white discharge or a blood, again that is an early sign of the breast cancer. If we treat breast cancer at early stage, they are not going to lose their breast, and radical mastectomy should not be done nowadays because they should be treated before that. Now, role of general practitioners, again, early diagnosis, they are the people because they visit them a quite lot of time for many reasons. Safe environment should be done, screening for domestic violence, family counseling, referral to specialist as early as possible, mental health referral, empowerment to women. Now, what is the take-home message for this group? Physically demanding, emotionally overwhelming, socially pressurized. A woman in this phase does not just need treatment. She needs understanding, protection, and support. And what's the thought? If we protect and support a woman in her reproductive year, we protect an entire generation. That is very important. The last but one is perimenopausal age. That is also very important. From the age of 45 to 55, many of the conditions are going to prevail. Perimenopausal, hormonal problems, ovarian function is declining, estrogen is reducing. That's why they develop common problems again, like heavy bleeding, short bleeding, and abnormal uterine bleeding should be evaluated. Vasomotor symptoms are very common. Hot flushes, night sweats, palpitation, sleep disturbers. For all these, they go to cardiologist. But essentially, it is a hormonal imbalance, estrogen deficiency, which can be treated by giving safely estrogen tablets. And urogenital problems are very common in this group. Vaginal dryness, dyspareunia, recurrent UTI, often urinary continence are seen. Weight gain is very, very important. Weight has to be reduced. Central obesity is worst. Insulin resistance, hypertension and dyslipidemia are common problems we will see in the woman. So that's why diabetic and cardiovascular problems can be avoided. Again, the most important in women is bone health. Because of the loss of estrogen, their bones are going to be very, very weak. They are likely to fall and they may end up with a fracture. So rapid bone loss is there, osteopenia, osteoporosis. That's why the general advice is you start the tablets of vitamin D and also calcium for every woman. After the age of 40, they must take one tablet of calcium and weekly one vitamin D. That will go a long way in keeping their health good. Mood changes are also very common because of this perimenopausal problem. Often misinterpreted as she is overreacting. Hormonal fluctuations are the reason. They will have sleep disturbance, insomnia, night sweats, anxiety, weight gain, hypertension, loss of identity. They feel they are alone. Emotionally, they feel I am no longer needed in the house. That is not true. Their presence in the house is very, very important. They are the pillars of the house. Old age women in the house are the pillars of running the house, and we should treat them, keep them healthy. Domestic violence are seen even in the old age people. That should be prevented. And marital strains are occurring, reduced libido, vaginal dryness, sexual discomfort. These can be talked to them and you can give treatment for that, which is treatable cause. Financial and social abuse can also be attended. What are the red flags for general practitioner? Postmenopausal bleeding is very, very bad. Anybody who has got a postmenopausal bleeding, immediately you must take a biopsy of the endometrium, rule out the endometrial cancer. Third most common problem is endometrial cancer. Sudden heavy bleeding, breast lump, pelvic pain. So that should be immediately attended. What is your role as a general practitioner? Detailed menstrual history you can take. Rule out malignancy. Screen for anemia. HRT is another one where you can start hormonal replacement therapy and you can change their life. Lifestyle modification, mental health screening, domestic violence can be prevented, and hormonal replacement can be given. And what is the take-home message? Perimenopausal is a natural transition, a vulnerable emotional period, a high-risk medical phase. This woman needs understanding, support, screening, and respect. What is the closing thought? A woman in perimenopause is not ending. She is just transforming. And the problems are very commonly seen in this age group. Hormonal challenges can be attended. Genitourinary symptoms can be treated very easily. Osteoporosis can be prevented by giving the calcium and also the vitamin D. Cardiovascular diseases can be detected by doing a lipid profile, and postmenopausal bleeding, again the bleeding if it is excess, and gynecological cancers has to be prevented. They are the number one cause for death in the woman. Endometrial cancer, ovarian cancer, cervical cancer. All these, if they are detected in early phase, 100% they can be treated. Mental health can also be treated. Psychological health can also be looked on. Sexual health can also be used. So role of a general practitioner is screen hypertension. You are the first person. They are coming to you very often. Every time make it a habit to see the blood pressure, because blood pressure will not come with any sign. Suddenly somebody will get a blood pressure, they will fall and they will end up with a cerebral hemorrhage. Diabetes is increasing, please screen for diabetes. And screening for the diabetes is very simple, that you can do a blood test. And lifestyle management, calcium rich diet, vitamin D supplementation, regular exercise, weight control, if they are having any smoking habit to be stopped. So hormonal replacement therapy, what are the holistic approach to postmenopausal women is, it is not a disease, it is a natural transition. Please focus on physical health, emotional well-being, social dignity, automatically they will improve. So what is the conclusion? After 55 years, women are living now up to 75 years. And women face physical challenge, psychological challenge. Screen early, counsel them, empower them, healthy aging we need. Lastly, if you believe in yourself, anything is possible. If you believe that you can practice obstetrics and gynecology, it is possible. Only thing is, our friends, general practitioners should make up their mind to practice the obstetrics and gynecology. That it should be not be only practiced by gynecologist. That early approach can be done by you. If you need anything, again you refer to the gynecologist, that you can definitely take care of them. So thank you very much for your patience hearing. I have tried my best to cover this very vast topic. I have not discussed any of the problems individually. I have just given an overview of the common gynecological problems faced by you whenever a client woman comes to you. I think you can think all these. So thank you very much for giving me this opportunity. I thank Karveer Kalkol sir for inviting me for this wonderful stage where I can share my knowledge of the last 40 years. And the president of IMA, thank you sir joining. And I thank all the members who have.
Thank you very much, sir.
Thank you very much.
Thank you very much, sir, for your wonderful presentation. From first year to 70 years, you have explained all
Yes.
the diseases and the well-beings of the woman. So how you should be taken care by the clinical practitioners. So thank you very much, sir. And I open for questions for all the members who are
Yeah,
interested
welcome for the
to
question.
raise any questions.
Sir, one thing, sir, you have covered everything from womb to tomb, and you have not left even the violence against women. That is the point.
That is the biggest problem.
We highlight, sir.
Yeah.
Really,
See,
even in OBG practice, we get
Yes.
even abruptio placenta, so many things because of
Yeah.
violence. And FOXO is becoming more and more day by day.
Yes.
So
Yes.
everything you have just mentioned, it's impossible to cover in 45 minutes everything. But
Yeah.
in a nutshell, you have explained
No, I
everything.
have not covered any topic. I have not
Yes, sir.
touched any topic extensively.
Yes, sir. Yes, sir. Thank you. Thank you, sir.
Thank you, Veena.
Sir, good evening, Dr. Durgadas here. Sir,
Good evening.
excellent message, sir.
Thank you.
Sir,
Thank you.
yeah.
Thank you, Durgadas.
Only thing,
Durgadas is our president of our Kasoga, who has taken time to attend today. Thank you, Durgadas.
yes, sir, thank you. So you
We
have
know
built
him,
up the
sir.
confidence in the general practitioners that they can treat it.
Yeah,
I
general
mean,
practitioners should start practicing.
No, that's what. Correct. Because they are the primary physicians for the family.
Yes.
So the minutest the problems, they go to them first. First
Yeah,
they meet is the family physician.
Yes, and they have got more confidence in the general
Exactly.
practitioner than the specialist.
Yes. No, I have seen so many times patient coming with labor pain. Even
Yeah.
if they come to us, no, once they will go to their family physician and ask, "Sir,
Yes.
the gynecologist is telling this. What shall we do?" So that is
Yes.
the message. The GPs, you have built the confidence that
Yes.
they have to treat this. Thank you for the message, sir.
Thank you.
Virabhadra sir, good evening. I am
Sir,
a
good
president,
evening.
state president, sir.
Good evening,
Nam
sir.
Tumkurnavaru.
Thank you, sir. Thank you, sir. ನೀವು ತುಮಕೂರು
ಅದೇ ನಮ್ ತುಮಕೂರ್ನವ್ರು ಹೇಳಿದೆ
ಪ್ರೌಡ್
ಸರ್. ನಮ್ ತುಮಕೂರ್ನವ್ರು ಅಂತ ಹೇಳಿದೆ. MG ಸರಿ ಗೊತ್ತಿರ್ಲಿ ಅಂತ.
Sir, ನಾನು question ಕೇಳ್ಬೋದಾ? ನಾನು Dr.
Madam.
Indira. Sir, nowadays PID is increasing in the younger age groups, sir.
Yeah. See.
Not even married. They come
Yeah.
within some 17, 18. They have the PID symptoms, the free fluid in the pelvis.
Yes.
So they
madam,
are not in definitely they are not in sexual contact.
no,
How to explain this, sir?
sexual promiscuity has become more common. Let me tell you
Yes,
a
sir.
survey which is done in Bangalore by
Yes,
my
sir.
colleague.
Yes, sir.
What they have found is that incidence of sexual exposure in the college going girls has gone beyond 30%. So
Okay.
the main cause is sexual exposure, whether they are married or unmarried.
Okay.
And the one of the commonest route for infection is through vagina. Infection never comes from above or from the side. This is the
Yes.
only open area. I
Ah.
think if you take confidentially history, there will be some history of exposure. And again, PID has become very common. And
Yes,
we
sir.
know the complication of PID. It damages so much so. And look into your infertility group. 30% of your patients are PID.
Yes, sir.
Post PID complication.
One thing, sir.
Yeah.
I'm going to school in the awareness of clean hygienic practices of menstruation,
Yes,
as well
ma'am.
as injections, HPV injections. So when I saw them,
Yeah.
you are using government given plastic parts.
Yeah.
That is again they're incinerating. There'll be again there'll be so much of dioxin released into the environment. Not a clean disposable. So
Yes.
now
I
government
think
is again giving only plastic disposable parts. Sir. Can it be like microfiber reusable parts?
yeah, microfiber reusable should be done. That is the
Yes, sir.
change has to be done.
Yes, sir. But government are even now they're
Yeah,
planning
they are
for
giving that only.
disposable only. That's the problem.
Yes, madam.
And I'm
I
glad
fully
to say
agree
you
with you,
that
madam.
I've given so far 160 doses of this HPV immunization, sir, to the school
Yes.
school kids.
Yes, madam.
Yes. Thank you, sir.
Thank you.
Calconda, sir.
ಸರ್ ಇವತ್ತಿನ ವೆಬಿನಾರ್ ಉಪನ್ಯಾಸ ಅತ್ಯಂತ ಉಪಯುಕ್ತವಾಗಿತ್ತು. ಎಲ್ಲ ಜನರಲ್ ಪ್ರಾಕ್ಟೀಷನರ್ಸ್ಗೆ
Thank you.
ಒಂದು ಧೈರ್ಯದ ಗುಳಿಗೆಯನ್ನ ಹಿರೇಮಠ ಸರ್ ಕೊಟ್ರು ಅಂತ ತಿಳ್ಕೊಂಡು ನಾನು ಹೇಳಲಿಕ್ಕೆ ಇಚ್ಛಪಡ್ತೇನೆ. ನಮ್ಮ ಕರೆಗೆ ಹೋಗೊಟ್ಟು ಉಪನ್ಯಾಸಕ್ಕೆ ಒಪ್ಪಿಕೊಂಡಂತಹ MG ಹಿರೇಮಠ ಸರ್ಗೆ ಮತ್ತೊಮ್ಮೆ ನಾನು ಹೃತ್ಪೂರ್ವಕವಾದಂತಹ ಧನ್ಯವಾದಗಳನ್ನು ತಿಳಿಸ್ಲಿಕ್ಕೆ ಇಚ್ಛಪಡ್ತೇನೆ.
Thank you.
Thank you, sir. Thank you very much.
Thank you, sir.
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
And I thank all the members of IMA, the president of IMA, KSP, and Secretary Surya sir, and President-elect Dr. Harish Dilendabettu, and other members who have joined for this webinar and making this a grand success. Thank you very much, sir.
ಥ್ಯಾಂಕ್ ಯು ಸರ್.